What is bioethics, and what does it have to do with you and me? Bio means life, and for our purposes, bio means anything related to healthcare. And ethics is, well, doing the right thing. Before we go into details, let's pretend you saw this on the news. This is Andrew Stevens from WIFM News. Our newsmaker tip line received this call just moments ago.
My daughter-in-law works at Samaritan Hospital, and she just posted on Facebook that somebody stole a baby.
Details are sketchy and unconfirmed at this moment. Our WIFM on-the-scene reporter has been dispatched to gather more information. To repeat, we have an unconfirmed report from Ashland Samaritan Hospital that a baby has been abducted. Stay tuned. We will bring you Shelley's report as more information becomes available. So, what do you think? Now, today's exercise has nothing to do with newscasters or news reporters. It has nothing to do with Facebook or calling the news line. It has nothing to do with kidnapped babies. We're actually not even going to talk about medicine. Today, we're only interested in bioethics and what comes out of our mouths. People who contemplate such things tell us there are 4 questions we should ask ourselves, 4 decisions we should make before we open our mouths in this type of a situation. First is the right to autonomy. Autonomy means I have the right to make my own decisions regarding my health care. It also means I have the right to decide who sees my records, who sees my information, and who doesn't. So the question autonomy makes us ask is, will they still be in charge of their own decisions and their own information after I open my mouth or do whatever it is I'm planning to do? If my planned action passes the test of autonomy, the next question I must ask is that of beneficence or benefit. In other words, my action must do good. Will this probably be good for them? If the action I'm thinking about taking will not violate their right to decide for themselves, and if it is neutral on doing them good, we then consider non-maleficence, that is, do no harm. Ask yourself, would they actually be better off if I did not do this? Now, if we have passed the first 3 tests, there is one more. That is the question of justice, fairness, discrimination. Would it be fair to treat everyone this way? And of course, would I like it if people treated me this way? Watch the beginning of our newscast again, and then we'll talk about these 4 points. This is Andrew Stevens from WIFM News. Our newsmaker tip line received this call just moments ago.
My daughter-in-law works at Samaritan Hospital, and she just posted on Facebook that somebody stole a baby.
Let's look at the employee who made the Facebook post. First, think about autonomy. Does this Facebook posting keep the parents of the baby in charge of their private information? Does this Facebook posting keep the hospital in charge of confidential information? You have heard of HIPAA, haven't you? This single Facebook posting breaks ethical rule number 1, as well as federal law. On this basis alone, that Facebook posting should have never been made. But for the sake of argument, let's move on. Did this posting produce benefit? Did it do good? Will this Facebook posting probably be good for the parents of the baby? Is it reasonable to assume that this posting will be good for the hospital as they deal with this situation? Will this posting probably be good for the law enforcement as they try and do their job? And lest we forget HIPAA and the federal government, will this Facebook posting probably be good for the person who posted it? I do not believe you could answer yes to any of those questions, but if you answered all of them, well, maybe it could do good. Let's move on to our third consideration, non-maleficence. Do no harm. Can this Facebook posting reasonably be expected to do harm to the parents or to the baby? Can this posting reasonably be expected to interfere with the hospital as it deals with this situation? Can this posting reasonably be expected to interfere with law enforcement as they deal with the situation? If it can be expected to do harm, you cannot do it. And finally, we consider justice, fairness, discrimination. Would you consider this Facebook post to be unfair to you if you were the parents, or if you were the hospital, or if you were emergency and law enforcement personnel trying to deal with this situation? But what about the person who made the phone call? They're not an employee.
My daughter-in-law works at Samaritan Hospital, and she just posted on Facebook that somebody stole a baby.
We're going to ask our caller to make the same 4 decisions before she picks up the phone. Will this phone call protect the rights of others to decide who knows their private information? If it does not interfere with their right to privacy, will this phone call help? Now, before our caller justifies gossip by pointing out the fact that maybe if the public knows what's going on, they can help find the baby, remember, if the police need the help of the public to find this stolen baby, the police will ask for it. Already we can see that this phone call will break the autonomy or the confidentiality of all the people involved, and that it will do no good. But will it do harm? Could this phone call cause interruptions for those dealing with the event? Could this phone call cause unwanted stress on the family of this baby? And finally, is it ever just or fair to spread gossip and unconfirmed stories? Before we finish, I have one more little question for you regarding our make-believe story here into bioethics. What are you going to say when your friend asks you what you know about the story?